はい、録画も始めてください。はい。はい。Welcome to a press conference at the Foreign Correspondents Club of Japan. My name is Teddy Jimbo. I'm a co-chair of the committee that handles the all the media events such as this. And we've been trying to deliver online press events under this sort of strenuous corona situation. And we have another press conference today with the speaker, Professor Kazuto Suzuki of Hokkaido University. Someone speaking on the Zoom. I guess I forgot to mute that person's microphone. Okay, let's mute it. Okay. Again, I'm kind of doing as a one-man band today. I'm acting as a sort of a technical director as well as a moderator today. So sometimes it's got a little bit overwhelmed, but I try to do my best. Anyway, Professor Suzuki is the professor of international politics, but he specializes in the technology, science, and national security. So his area does touch upon the coronavirus situation, because it is obviously a technology issue, science issue, as well as the national security issue. And he says that as many of you are well aware, Japan's response, or Japanese government response to this corona situation is under fire from some sectors, with a very limited number of PCR tests and not too strong like a lockdown measures and so forth. But Professor Suzuki says Japan is doing good. In fact, he says Japan is doing great. So I thought, for the sake of hearing from both sides, we invited Professor Suzuki to speak and to explain why he believes that Japan is doing a great job in dealing with this corona situation. So Professor Suzuki is going to speak about 20 or so minutes first, and then we're going to take a Q&A. And we have about a dozen reporters pre-registered on the Zoom. So we will have questions from those reporters first. And then if we have time, if time allows, here is the email address to which you can send in your questions. これ出せますか? Okay, this is the email address that you can send in your questions, and I can't really promise because I don't know how things gonna go. But if we have a time to ask questions additionally, we will ask questions from coming into this email address. So this is the email address you can send in your questions. If you can send, you can put your name and affiliation. That'd be even great. Okay. So, Professor Suzuki, thank you very much, and please start. By the way, he's in Hokkaido now. He's in Sapporo.
Right. Well, thank you very much, Jimbo-san, and thank you very much for everyone to come in. My name is Kazuto Suzuki. As Jimbo-san introduced me, I'm a political scientist. I have no epidemiologic background, but since I'm working on the science and technology and security issue, which the COVID-19 subject falls into this issue, and well, if you do the international relations, you can't really avoid this subject after all. So please don't ask any epidemiological questions, but I'll be happy to explain how Japan respond to this coronavirus threat. And I wouldn't say Japan is great, but I am trying to make a fair assessment of what's been done and what are the reasons for relative success. If you look at the death rate or the reducing number of the new cases, these are the product of the partially because of the political initiatives, but also because of the social structures and the social norms. So these are the basic framework that I'm going to discuss. So let me just start sharing my slides. Okay, so just look over the short chronology. When I read and watch the foreign reporting about Japan, there are lots of sort of links between the Japanese actions and the Olympics. That is, to some extent, if you look at the political discourses, yes, there are lots of discussions about the extension of the or postponement of the Olympics in the mid-March, but the key issue was what happened in Hokkaido, where I am from, and the Hokkaido. The governor of Hokkaido unilaterally declared, without any legal background, to explain or to declare the state of emergency in late February, and that was when there was a sort of a spread of viruses in Hokkaido, but the first wave have just going down, and the governor decided to lift in March 19th. And this is a crucial time because there was a postponement. The discussion of the Olympics took place in this time, but the key issue was the March 20 to 22nd. That is the 3-day weekends, and this is a Hanami season, and everyone go out and spread the virus. So, and it's not only Hokkaido, but it's a spread of the virus in Honshu and elsewhere. At the same time, this time there were a lot of people returning from Europe from business, from tourism, and there was no testing for those returnees. And these are the seeds that spread during this 3-day weekend, and this has resulted the second wave of the infections in the early April, and this led to the state of emergency declaration of state of emergency by Prime Minister Abe in April 7th, and then it is now we are under the state of emergency now. So today I'm going to talk about Japan's strategy, but in background, we need to understand that we do have the internationally experienced those people who led the WHO activities in Western Pacific. Dr. Omi, who I think many of you know him. Dr. Omi, who was one of the candidates to be the Director General when the Margaret Chan was elected, and Professor Oshitani, who was leading epidemiologist to fight against SARS, and Professor Nishiura of Hokkaido University. He is the leading researcher on the modeling of infection. So we are lucky to have these people, the international class experts who are developing the Japanese strategy. So the role of experts are extremely important in the Japanese in Japan's case, and well, in association with the lack of political initiatives. They think that those experts think that we are in a very dire situation because this COVID-19 is a very unique and different from SARS, MERS, or novel influenza in 2009, because the spread takes place when the patients are asymptomatic. So the asymptomatic transmission is the very it's very dangerous and difficult to catch because you can't really get tested for those people who doesn't show any symptoms. Also, Japan is under constraints of the lack of tests. And I agree that there are a lot of discussions about the number of tests. And initially, the number of tests available the capacity was about the 1,500 tests per day in late January. So these people are very, very concerned that if there is a big shootout of the patients and the spread, then we are not able to test them all. And also we do have a very limited number of ICU beds, 4 beds per 100,000 person. And that is one of the key issues. So the major objective of the Japanese strategy was to protect tests and the beds, and to make sure that we do protect the medical institutions. And also there were a problem. This is a political and legal problem. That's the COVID-19 was designated under the infectious disease law. This law requires a mandatory hospitalization of those people who came positive. So if you do number of tests and there are lots of positives, then you can, and there are lots of people occupying all the beds in the hospital. So this was the sort of a prerequisite conditions of the situation in the late January, early February. But what was interesting was that the experts find a very unique conditions or unique characteristics of this COVID-19, which is that there are 80% of the infections, 80% of the patients are not transmitting the virus to other people, but the 20% of the patients are spreading heavily on the multiple people. It can be 5, it can be 20, it can be 100. And this has been the problem. But the experts build up a strategy based on these characteristics by finding the cluster, those 20% of people who are spreading the virus. And if you contain those 20% and spread and prevent the spread to those large number of clusters, then we'll be able to at least minimize and mitigate the spread of disease. So this is the cluster-based approach, and it is, of course, based on the hypothesis of the data that they acquired from Wuhan and also the Diamond Princess. So they did the thorough research on these existing cases, and then they built up this cluster-based approach. So, and the second element of the Japan strategy is the behavioral change. And this is different from the so-called social distancing. The social distancing is taking the physical distance of people, but the Japanese epidemiologists have proposed a different approach to avoid 3 C's. The crowded places, the closed space, crowded places, and close contact settings. So these 3 C's became a norm of the personal behavior in the social gathering. So even you are in a sort of situation, if you are in open air and you have the not so close contact and it's not crowded, then it will be okay. And that allows much more freedom than social distancing. So this has created the sort of enabled the sort of let's say a soft lockdown approach, which means that it's not exactly a lockdown like what happened in China, or even the softer cases in Italy or France, or much sort of looser case in New York. But the Japan looks much looser, but because there are sort of a common understanding to avoid the 3 C's. Also, Japan has an advantage of having the customs of wearing a mask. Because of the hay fever, there are lots of people wearing a mask, and therefore it is not so strange and uncomfortable for people to wear a mask, and it quickly becomes as a norm. Of course, there are questions about the Abeno mask, that the government providing the mask because of the lack of supply. But well, that's another issue. But nevertheless, there is a very strong social norms to wearing a mask. The washing hands is also a very important element of preventing the spread of virus. And Japan has a very long tradition of teaching the washing hands in elementary schools and all the daily lives. So it also became as a social norm. So these are very much contributing to the reduction of the spread of the disease. The third strategy is hammer and dance. The hammer and dance is well, first proposed by the Thomas Puyo. He has written a number of articles on this. This is the idea that you cannot eliminate or you cannot terminate the spread of virus. There is an assumption that because of this asymptomatic patients spreading a virus, it is impossible to find out all the cases. And therefore, there is always a possibility that there is someone hiding behind this asymptomatic condition, that the virus hides behind them. And then there is a possibility of the spread again. So if there is an increased number, not exponential, but if there is a sort of a signs of the exponential increase, then we put the hammer, which is the draconian measures. We haven't yet done it, but I think the current soft lockdown has produced a certain result and effectively working like a hammer. And what the epidemiologist and Japanese strategy is trying to aim is to lower the number of cases and remain in the down segment on this chart. So we cannot make it zero, but we can make it manageable level and chasing the manageable size of the cluster. So currently we have about 450 clusters in entire nationwide, and if we reduce them to the level of 30s or 20s, then we can do the aggressive contact tracing, and that as long as we can do that, we'll be able to manage the spread of virus. So that's the basic idea of based on this cluster-based approach and the hammer and dance. So this is the current trend of the Japan's case. I'm sorry that it's taken from the Japanese side. This is the new cases, and there is explicit downward trends. Although there are a lot of criticism about the number of tests, but there are we are now conducting about 8,000 tests per day, or up to, we are capable of 17,000 tests, but now we are conducting about 8,000 to 9,000 tests. And we do have the positives in the lower hundreds. So we have 3 days lower hundreds. So that is the good news. And we also have the lower number of deaths. If you look at the number here, there are about the 20s, 25s. So it's still the two-digit numbers. And that is extremely different from the situation in the major European countries or United States. The goal of Japanese strategy is that we live with virus, as I said. There are too many asymptomatic cases, and you cannot contain or eliminate viruses. So it is important to control the infections in the small size clusters, and that is where we need to have the number of tests. And I think the current number, the 17,000 capabilities, is good enough for the current size of the, how can I go back? Oh, okay. The current size of the spread is lower than hundreds. So 17,000 tests is good enough to figure out how many people are. So we are able to identify major symptomatic cases, and we do not have to have glitches of going through the process of having a test. There is some misunderstanding that the test is not for everyone who wants it. Test is for everyone who need it, or the doctor says who need it. So for current moment, the Japanese situation of the testing, we have good enough number of tests in order to identify the trends and identify those who have symptoms. Also, the goal of Japan's strategy is how to balance the economy. Of course, as you know, the government is not taking a sort of a clearer stance to identify where the criteria lies to lift the state of emergency. And Osaka Prefecture, the Governor Yoshimura is now proposing his own Osaka model, which is an interesting case, and I think it is a very reasonable model. So there is a criticism on the government, and I do agree with that. But nevertheless, the entire idea of the Japanese strategy is to fight against COVID-19 is to maintain the behavioral change, maintain avoiding the 3 C's, and to let people work as careful as possible. So our traditional behaviors like commuter trains or dining in izakaya or karaoke box, these may not be lifted for longer time, but we will be able to start working, we'll be able to start shopping and while avoiding 3 C's, and these are the sort of an exit strategy at this moment. Although it's not in the figurative way, but still, I think this is a sort of in the vision of the experts and the politicians. The key issue here is that from the beginning, the Japanese strategy's objective is to maintain the sustainability. So the hammer and downs is the strategy to make sure that we do take the very hard measures or the draconian measures if needed, but to remain the number of cases in the downs segment, and to make sure that it can be sustainable. So we live with the virus, and we try not to eliminate everything, but to control the situation and make it as a sort of a seasonal flu kind of epidemiologic disease. So again, the testing, I mentioned a couple times that the test is not the Japanese strategy, because first of all, you cannot test everyone. Well, this only happens in Iceland, where there is about 300,000 people, inhabitants. The United States is now planning to do the million test, or 900,000 tests per day. Yes, that's an extreme number, but the population of the United States is about 340 million people. So if you have the million test, it takes about 1 year. And the testing is just proof that you are positive or negative of that time. If you are negative, you'll be happy, but maybe tomorrow you get contracted. So it's almost impossible to find, to prove that the virus is gone. and virus can be hiding behind the asymptomatics. Also, the accuracy of tests has been always been under question. There are many false positives. The false positive come from sensitivity, and the PCR test is about 70%. But well, of course, those people, 30% people who are negative, but turns into a positive, that's well, okay, it's a precautionary measures. But the problem is the false negative. The false negative means that you are positive, but the test says you are negative. And that is a very dangerous situation because these 5% people will spread the virus. So test is not perfect. And we have to remain that, keep that in mind to make sure that the test doesn't solve the problem. The Japanese have the strategy. Japanese idea is the strategic testing. That the idea, because of the case is limited and the number of testing was limited. So this is a sort of a chicken and egg question. But the idea was, since the sensitivity and specificity are not so perfect, then what we need to do is to limit the people to test when there is when there are symptoms of pneumonia, etc. So it is a doctor's choice or doctor's definition, or doctor needs to designate those people who have the test or who needs to have a test, and it's not for the people who wants to have a test. Because in 2009, the novel influenza, we have let people take tests, whoever who wanted, and that overwhelmed the test centers. And when there is an outbreak of the disease, hospitals and test center is the hotbed, because this is where those positive people comes in and spread to the negative people. So from the experience of 2009 influenza, the experts have set this idea of strategic testing to limit the number of people who get tested, and therefore those people who feel that they have, who seem to have symptoms, but the doctors, if the doctors said you don't need to, then you don't get the test. So there is a lot of dissatisfaction about this treatment, and those people who are anxious whether they have the COVID-19 or not want to have a test, but the Japanese strategy was to limit the number of people who get tested. So this is the source of criticism, and I understand that, but I think that Japan should expand the capabilities much earlier. But as a social scientist, I'm just explaining that this is the way of thinking of the Japanese strategists. So this is the current situation in the PCR test. We have about 9,000 to 8,000 tests per day, and there are ups and downs because of the dates and the weekends, but the number is increasing. And mind you that the increase of the numbers comes in early April rather than the late March, when there was a decision to make the postponement of the Olympics. It is basically the idea of the number of testing is increased because of those people who are contracted during the 3-day weekends. So the purpose of the testing in Japan is to find out the trends of infections, and of course find out the cases and isolate to limit the spread of viruses, and to protect doctors. So again, as I said, the testing is not the solution. Testing is the means to achieve goals. So if you have the thousands of cases, then where do you put these people in? Because if you leave them in home, then there will be spread within the house, within the household, and possibly with spreading to the local community. So testing has to go with the appropriate measures to isolate them. And testing alone is not the solution. And testing is not for your comfort. Testing is for the public health. This is the Japanese model. And whether you like it or not, this is how the Japanese strategists think. And the government is now trying to increase the capabilities, and antigen test is now introduced. And currently, the positivity rate is about 7.5%. So the number of testing is sufficient. But if there is an outbreak or exponential outbreaks again, then we need to have more testing. So it has to go with the number of cases. Okay, this is what I explained in the various ways, so I'll just skip it. The governance issues. The role of experts is important because of the lack of political commitment. The Prime Minister has initially tried to take the leadership and without consultation of experts, and then he was strongly criticized when he decided to close the schools. So since then, Prime Minister is taking the sort of a back-off approach, and he lets the experts to decide everything. And he endorses the experts' proposals, and therefore the experts now becoming as a strategist. And therefore, there are certain parts of the community is now criticizing experts because of the lack of political legitimacy. And also, there are people who are suffering from the lockdowns and economic problems. So they are criticizing the experts. There are questions about the Swedish model. Japanese model is different from Swedish model. Swedish model is, the basic idea is to separate those high and low risk population. The elderly people has to stay home, and younger people can go work. But this is not really producing the good result. If you watch the Trevor Noah Daily Show, then he was interviewed by him, and he's explaining that he was surprised about the death toll. So it wasn't really successful to protect the high-risk population, and that has been a problem, and that's one of the reasons why there is a high death toll. The death per million is about 300. In the perspective, in the United States, it's 235, and the UK, it's 469, and Japan is 4. And finally, there are a number of people who said, oh, Japan is hiding, Japan is not reporting. Maybe, but you can't hide the mortality rates. You can't hide the people dead. And there are lots of cases that excessive mortalities, which is going above the average of the average annual death or average deaths per day, and UK, France, Netherlands, etc. But in Japan, because we are taking extra cautious measures for the health and we are taking extra caution, washing hands and wearing masks. The death rate is going down lower than the average. So this is what happened in Japan, and this perhaps is one of the proof that the Japan's model is producing a result. Anyway, I'll stop here. Thank you very much.
Thank you, Professor. So I'm going to go to Q&A. I'd like to see some hands up first, but before I go to reporters. So Professor Suzuki, the Prime Minister Abe had said in the press conference that he's very serious about increasing the number of PCR tests. So you don't think it's a good idea?
Well, it is a good idea. It is a good idea to have a capability in order to prepare for the case of the overshoot. If there is overshoot or the exponential increase of the number of cases, we need more tests. So increasing the capability is good, but current number is sufficient in the current situation because the number of cases are going down.
So you agree only with the increasing the capability, not the actual numbers?
Yes, because if you do more testing, you get more false negatives.
Okay.
And that is the danger.
Okay, got it. Okay, let's go to Q&A. We have Andy Sharp from Nikkei Asian Review. Andy, go ahead.
Hi, and thanks very much, Professor Suzuki. Appreciate you coming on. So 2 questions of a more political nature than your presentation. Mm-hmm. We have Prime Minister Abe tomorrow expected to give a press conference talking about lifting the state of emergency in some regions.
Yep.
What would you advise Mr. Abe in terms of reopening the economy, lifting the state of emergency? What kind of signposts do you think he needs to give the public? Mm-hmm. My second question is on the economic support packages that the government has implemented. There's been criticism that they're slow or over bureaucratic, etc., etc. So could you just give me your basic overall view? Maybe not going to the right people. What is your assessment of the government's economic support packages? Thank you.
Right. Well, first, the advice to Prime Minister is that, first of all, he is not going to lift nationwide state of emergency. So, which means that there are areas where still there is a state of emergency and there is a area. And this is what happened in Hokkaido. Hokkaido declared the prefectural state of emergency, and then we lifted in the March 19th. And the next day was the 3-day weekend. And there are lots of people coming in from other side, and we didn't control the migration. So moving people between prefectures or those where there is still the spread, and you need to separate. You need to have control the migration of people moving from the place where there is still a spread and to those places where it's not. The second question, economic support. There are hundreds of thousands of people have different. If you ask anybody, you get a different opinion. I think in general, as a public policy, it's slow. It is very bureaucratic, even though they tried to shorten the time, but still it is very problematic. And I think largely because the Japanese bureaucratic system doesn't really fit into the emergency situation. I was a member of the investigation team for the Fukushima accident, and I felt the same. Well, I wrote the same conclusion, and now I am conducting the research project of the 10 years after of the Fukushima accident, and then we come across as the same conclusion that the Japanese bureaucratic system is not fit for the emergency, and then we have the same situation here. So I think it's a bureaucratic red tapes and inflexibility, and that has been a problem. And I am sorry for those people who are expecting to get the economic support, but unfortunately, I think it will take more time.
Okay, thank you. Okay, then moving to we have Gerard Rady of Bloomberg. Gerard, go ahead.
Go ahead. I think Mojoko was first. If she wants to go ahead.
It's all right. Go ahead. You go first, and then
sure.
I go to Mojoko after that. Yeah.
Okay. First, thanks very much for your time. This is Gerard Rady from Bloomberg News. As a political scientist, how would you rate the government's communication? I would say, like, both domestically and internationally. There's a lot of stuff that you explain there that is definitely true, but which the government hasn't outright said. And I think especially about the fact that, you know, the assumption that the virus cannot be, you know, it can't be terminated, it can't be contained, which definitely seems to underlie a lot of the things that the government is doing, and the contrast that you see with other countries. But, you know, I don't think we've heard that kind of clear message from the government. So I guess my question is how would you rate their communication, and what could they do better?
Right. I fully agree that the communication is very poor. And again, my recent research on the 10 years after Fukushima, we also mentioned the same thing about the lack of communication and lack of providing information and transparency. And there is a problem of, particularly in the information sharing with the foreign partners and foreign media. So there are lots of misunderstanding, lots of the, well, I think it creates a lot of room for people to guess. And I think it's a wrong way of communicating. And I think Japan has not learned anything from the Fukushima accident or the later of the other natural disasters. I think in Japanese, the Minister Nishimura, who is in charge of this COVID-19 issues, is trying to explain how Japan reacts and try to communicate with public. But I think his message is not clear, and I think Prime Minister Abe's message is definitely very weak, and it's not very it doesn't carry the message. So it's not just the way he talks and the number of press conferences he opened, but also it's the content and presentation that is that has been a problem. So I think I rate very poor for the public communication by the government.
Okay, thank you. Okay, we have Motoko Rich, New York Times. Next, go ahead, Motoko. Motoko,
sorry, I can't hear you.
Hold on. Go ahead. Go ahead.
Thank you so much for agreeing to do this. I had a couple of questions. One is sort of a little bit of a follow-up on the communication strategy. There has been a lot said by the government, and the government's even hired consultants and set aside a budget to improve its perception internationally, which seems a little odd to me that they're so concerned about that. But I also am wondering why you think the Japanese public seems to be quite dissatisfied with the Japanese response. According to polls that I read, that there's something like 57% say they're dissatisfied. I wondered, but the polls don't really kind of get into the details of what their dissatisfaction may be. My other question has to be, I'm a little confused by your explanation of the Japanese strategy with regards to the 3 C's being this such a successful strategy. Because you talk very much about that 3-day weekend being the kind of pivot point as to why the government decided that it needed to take more serious action. And you describe people going out for hanami, which is not a 3C situation. So I'm a little bit confused about why. I mean, I know the Japanese government has talked a lot about the 3C and the cluster management being their sort of the pillars of their successful approach, but it seems a little inconsistent with what has actually happened. Right. That when there was a threat of an explosion, which didn't happen presumably because of the state of emergency and the cutback on commuting and all kinds of things, they took a different turn. So I'm a little bit confused as to whether we can really fairly describe that as a successful model.
Well, it's up to you to decide whether it's successful or not. I just state that the result shows that it's we do have the lower number of cases and lower number of deaths, and that's what the number says.
Right, but that's after the state of emergency, right? I mean, that's in part because of the state.
You just, I mean, if you look the number of people, number of cases before the state of emergency, still it was about the lower, 3-digit numbers, and the death was much lower than, it was only 100. So I think, the Japanese strategy was successful. And I think responding to the second question, the 3-day weekend and Hanami was not just going out and watch flowers and watch cherry blossoms. It's where you sit and drink and eat together in a closed setting. And 3 C's is not that one, if you avoid one, then that's okay. No, you have to avoid all 3. So you have to avoid closed spaces and crowded places and the closed contact setting. Hanami is a close contact setting, and therefore it spreads. So that was the problem. And of course, it's not only Hanami, but also there are other places like the bars and the cabarets and all this kabukicho stuff. These are also considered to be the source of the spread after Hanami. So and the izakaya, it's also a very 3C situation. The karaoke, Hanami goes with karaoke. So if you go out for the Hanami and then you go to the karaoke box, that's a definite 3 C's. So again, Hanami is not just watching blossoms. Hanami associate with all these events. Okay, so that's the reason why the 3-day weekend was the key. The public dissatisfaction is largely comes with well, of course, it's a problem of the communication, but also because of the question from the Bloomberg News that about the lack of the financial support, and I think there is a fairly good understanding among people about the strategy that we take in terms of fighting against the disease. But if there is a government request or order or whatever you call it, the government request to stay at home, then the government should compensate. That's where the dissatisfaction resides. So I think I was mainly talking about the Japanese strategy to fight against the disease, but the dissatisfaction comes from the economic support. So these are 2 different things.
Thank you very much. That helps.
Okay, thank you. Okay, who's next? Okay, we have Patrick Walter from Frankfurter Allgemeine Zeitung. Okay, go ahead, Patrick.
Professor Suzuki, thank you for being with us. I have 2 questions, if I may. If I compare the Japanese reaction to the South Korean, Taiwanese, or even European reactions now, all these countries are working with tracing apps and a lot of technology, and the Japanese response seems to be very low-tech response. Do you have any explanation why that is the case? And my second question is, if you think long-term or medium-term, what do you expect how this crisis is going to change the role of the state in Japan? Do you expect that there will be further legal changes so that the state can intervene more into private rights, privacy rights, property rights? Do you expect a bigger change in a bigger role towards a bigger statist role in Japan, higher taxes, a bigger government intervention quota into the economy? Do you have any thoughts on that, please?
Right, thank you very much. The tracing apps is what Japan is now trying to develop the tracing apps with more anonymity than that one in South Korea or Singapore. The reason why the Japanese contact tracing is very analog, or the very old-fashioned, is because, well, of course, it's a lack of investment in the first place. The Ministry of Health is the least, I would say, high-tech ministry, and try not to put the strong emphasis on the on the improving the technology. The other reasons is that we had a successful model in the 2009 novel influenza. This was a time that we used this current model and using this very old technology to do the contact tracing, and that was fairly successful because it has more human touch in a way that because of this aging society, this sort of a human interaction seems to be working pretty well to find out the contacts rather than just using the apps. So I think these are the combinations of reasons, but I think the digital application helps, and I think the government is trying to develop one in the near future. The second question, the role of state, I don't think there will be a big change because, well, the prime minister is and some of the people who want to change the constitution take this as an opportunity to introduce the state of emergency in the constitution. But I don't think it's successful because we are able to do that without the constitutional change, and we are producing results. So in terms of the, and also there is a sort of group of politicians who have very strong concerns about the Japanese public debt. So if we do have the power of intervention, it has to go with the economic support. And one of the reasons why we have a very dissatisfactory economic support is because we have too much debt. So this is a difference between the Germany and Japan. Germany, Germany had a balanced budget for a long time, and they have the sort of a room to maneuver in fiscal policy. But in Japan, we don't. So I don't think that the government will have the bigger role to play after this.
Thank you.
Okay, thank you. We have another question from, Gerard Rady has a question from his colleague. So let's have Gerard online and see what his colleague's question is. Go ahead, Gerard.
Thanks. Just a quick question. What's your opinion? I mean, kind of follows up on the last question there. But what is your take on the need or the ability for Japan to create an institution like the CDC in the US, or I believe that South Korea has an equivalent as well? That's been one of the things that's been highlighted as lacking in Japan's response. And obviously, this is not the last pandemic that we're likely to face. What it seems like something that Japan should have, but do you think it's necessary or feasible?
Well, if you look at what happened in the United States now, the CDC is not really the sort of an ideal model that you can think of, and I think the relationship between the political leaders and the experts, and whether you have the CDC makes the politicians to work well with the experts, that's fine. In the United States, it's not. The political leaders are not taking the scientific advice seriously. So it's up to the politicians and the characteristics of the politicians, and I think the institution doesn't really help. Currently, the prime minister in Japan is very weak on the balance between the experts. The experts is taking too much responsibility, which is not a good sign. And if we set up the CDC, like a Japan CDC, and then it will put a heavy responsibility on the experts as well. And I think if the CDC, it creates the situation to protect the experts while they are focusing on their strategies and their work on the analysis of the disease, I would say yes, the CDC will be fine. But if you look at many other cases in Japanese governmental or governance institutions, I don't think this kind of the institution works. So from the experience of looking at, for example, the Japanese FEMA after the natural disasters, etc. But it's not working, and Japan has never had the FEMA type institution for the disaster relief. But we are doing fine. The self-defense forces and the local governments are working together, and perhaps the strength of the Japanese system is that because of the lack of the centralized institution, everyone has to work in the network, and that has given some flexibility to respond to the crisis.
Okay, thank you. All right, I'm going to just read out the question came in by email. This is a question from Denmark. Asger Royal Christensen. He says, when do Professor Suzuki expect tourism to be reopened, domestic and foreign? Many sectors are suffering. So when do you think foreign and domestic, both tourism be resumed, Professor?
That's a very difficult question to answer because we don't know the end of this COVID-19. Well, for sure, there will be a domestic or regional, like within Hokkaido or within the Tohoku, travel may be allowed in summer or sometimes in 2-3 months time. But inter-regional travel between the Tokyo and elsewhere or Kansai and elsewhere is going to be still difficult until towards the end of the year.
Toward the end of the year.
And international travel, you may expect 2 or 3 years. Wow. It's almost impossible. So Olympics, forget about it.
Forget about it, huh? Okay.
Yep.
So no marathon in Sapporo then.
No, unfortunately, but well, that's life.
Okay, all right. The very last question from myself, Professor. If Japan is doing, so great, or at least okay, without having too much burden as other countries do, would you recommend this Japan model, other countries to adopt this Japan model? I mean, or is this something that only works in Japan? And if so, why is that?
Well, I think, the people are now still gradually, particularly Europeans and Americans, are gradually understanding the importance of wearing a mask. And that is one behavioral change. But we've been doing that from the beginning. The avoiding 3 C's, I think it's a right strategy for the public mitigation methods, and I think it's better than the social distancing because social distancing is much harder. And of course, everyone wash hands. So this behavioral change, I think Japan's model is extremely useful for the other countries. And contact tracing, now people are now talking about contact tracing in the United States or elsewhere. But the problem is that contact tracing is only effective when the number of cases are low. No. It's good if it's under 200. You need to have experience. You need to have know-how to do the contact tracing. You can use digital means to supplement or to support the information gathering, but the contact tracing requires more. So I think the cluster approach is you need to have an experience and you need to have the methods and all the methodologies. I think Japan has built up the very contact tracing method with the old technology, so it can be applied for the other countries, and other countries are now realizing the importance of the contact tracing. But for example, in the United States, it is still too many cases per day, and it is impossible to do the contact tracing or the substantial contact tracing in this number. It has to go below hundreds, and to make sure that you can control it. So that's the message that from the Japanese experience. I don't know if Japan model as a whole may not be the sort of an ideal model, but these elements can be used and the experiences can be used by the other countries.
Okay, very well. Thank you very much. I think we're just about running out of time. And Professor Suzuki, thank you very much for sharing your very excellent expertise with us. And reporters, thank you for joining the press conference. And everyone, thank you for watching the press conference at FCCJ. And we're going to have another very interesting press conference tomorrow. We will have Professor Honjo, the Nobel laureate, with us tomorrow. So please look forward to that. So thank you again.
Thank you.
Thank you.